Alright, so now I'm going to talk about settings and how the ventilator reacts to what you do to it and how the patient reacts. So basically, when you are making changes on this ventilator, you want to think of it kind of like a pressure ventilator. So basically, our mean airway pressure would be similar to our PEEP. FiO2 on our blender, FiO2, same thing. So oxygenation wise, mean airway pressure and FiO2 are your main drivers of PaO2, or oxygenation. Ventilation, pretty much the same, except instead of a PIP, we'll have an amplitude, which pretty much is synonymous with PIP, and then we'll have a frequency. So frequency is pretty much the same, except 1 hertz is actually equal to 60 breaths per minute. So if we were on 10 hertz, the ventilator would be giving 600 breaths per minute. If we are 15, we're 900 breaths per minute. As opposed to a ventilator, which is about 40, and a jet's about 360 to 420 or whatever, 300 to 420. And high time is 0.33. Pretty much stays at 0.33. You sometimes can turn it up to 0.5, but we hardly ever do that, so I wouldn't even worry about that right now. So to get rid of CO2, we would want to turn up our amplitude. In other words, synonymous with turn up our PIP. However, on an oscillator, when we want to get rid of CO2, we actually want to go down on our rate. So let's say we were on a hertz 15 and we want to get rid of CO2, we'd actually want to go to 14. One, you can't go to 16, but like if you were on 10, you go to 9, and you wouldn't go to 11. And the reason is basically this inspiratory time is a percentage of our rate. So each hertz is a little breath. And each little breath has 0.33 I time and 0.67 expiratory time. Now, I don't know what the actual number is because it's a percent of this hertz. So just know that there's about 1 to 2 IE ratio type of thing. Now, we can't control the flow in this ventilator. I know we got a bias flow, but that's not the same thing. So we can't control that. So if we go down on our rate, now we don't have as many, in a minute, we don't have as many breaths. So if we go down, we've just stretched out our I time and our E time. So if we stretch out our I time at 0.33%, whatever that is, now we've given more flow because we've given the same flow for a longer amount of time. So just think of it that way. So if you were filling up a bucket of water and you hold the water down longer, you're going to get more water. Well, air's the same way. So if I hold the pressure down or the trigger down longer, you get more tidal volume. So basically what happens is when you turn this down, every hertz you turn it down, you're going to get more tidal volume. You also get a longer expiratory time. So if there is any chance that any gases are getting trapped, they got a longer amount of time to exhale. Also, that being said, this ventilator is active inspiration and active expiration. So when that piston is firing, it pushes in air, it actually is pulling out air at the same time. Okay, so to get rid of CO2, we go up on the amp, down on the hertz. If we want to lower CO2 or raise CO2, we go down on the amp, up on the hertz. PaO2, mean airway pressure is generally up, FiO2 is up. If we want it to go down, we turn down our FiO2, we may wean our map. There's a lot of stuff to go into what kind of map you want. Like I said earlier, that it's depending on whatever it is on the conventional ventilator, you want to be about the same or a little bit above. It also depends on the X-ray. So if your X-ray, if you've got flat diaphragms, your mean airway pressure is probably a little too high, so you want to turn it down a little bit.